Good day, students. Today we have a video lesson. The theme of today's video lesson is examination of the patient. First of all, let's introduce for you the aims of today's lesson. The first, to increase students' vocabulary on the theme. The second, to revise grammar themes. The third, to improve students' reading and speaking skills. First of all, let's introduce for you active vocabulary. Etiology, etiologia, pathogenesis, pathogenes, mechanism, mechanizm, visual, vizualda, palpation, palpacija, percussion, percussija, auscultation, auskultacija, cystoscopy, cystoscopia, edema, ısınu, hemorrhage, kan кету, objective, объективті, subjective, subjektivті. Let's read the text examination of the patient. Be attentively, please. Before treating the patient, it is necessary to make a correct diagnosis of the disease and to determine its etiology. It tests the causes of the disease. The doctor must know well the pathogenesis of any diseases, the way and mechanism of its development, as well as the symptoms by which it can be revealed. A number of different procedures is used to establish a diagnosis: history taking, physical examination, which includes visual examination, palpation, percussion, auscultation, laboratory studies, consisting of urinalysis, blood, sputum, and other analysis. Instrumental studies, for example, taking electrocardiograms or cystoscopy, X-ray examination, and others. For determining a disease, it is very important to know its symptoms such as breathlessness, edema, cough, vomiting, fever, hemorrhage, headache, and others. Some of these symptoms are objective. For example, hemorrhage and vomiting, because they are determined by objective study, while others such as headache or dizziness are subjective since they are evident only to the patient. Dear students, you should answer for these questions according to the text examination of the patient. The first, what must a doctor do before he begins the treatment? What must a doctor do before he begins the treatment? The second, what does the term etiology mean? The third, what does the term pathogenesis mean? The fourth, what does physical examination consist of? The fifth, what do laboratory studies include? The sixth, what instrumental studies are applied for making a diagnosis? The seventh, what kind of symptoms are called objective? The eighth, name some objective symptoms. The ninth, what kind of symptoms are called subjective? The 10th, what subjective symptoms can you name? The 11th, what can the doctor do on the basis of the findings of the physical examination, laboratory and instrumental studies, and the patient's complaints? Dear students, thank you for your attention.